Hiya. I'm really sorry I haven't made a video in absolutely ages, but I'm here and this is my video for mental health. First of all, I'm going to define mental health, well, what Wikipedia defines mental health as, and that is a state of well-being in which the individual realises his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make contribution to his or her community. I'm just going to quickly break that down, kind of thing. Basically, you're able to see yourself and reflect on yourself and cope with day-to-day life, but with normal stresses of life, not so you may not be able to cope with horrendous things like death, but you can cope with normal stresses like workload, getting places, that kind of thing. You can work productively if you've got good mental health, and you're able to make a good contribution to your community, meaning that you can help out your community, you can get involved, kind of thing. With regard to talking about it, giving you an idea about it, I didn't really know how to approach this, so I looked on the teen help forums at mental health to kind of get an idea of what people want to know about mental health. There are three kind of areas that I noticed. They are relationships and talking to a therapist, approaching a doctor, and diagnosis. After I've explained those, I'll talk a bit more about some other stuff. But relationship and talking with your therapist. Often the relationship between patient and therapist is quite, should we say, messy? Because usually the person you confide in and ask for help is a friend. So often the client, or patient, whatever you want to call them, feels like they should have that kind of friendly relationship with the therapist, but the therapist is there to help you deal with your problems, not to kind of take on your problems and be your friend. So they've got to maintain the professional role, so this can make them come across as a bit nasty, and not wanting to help you. That isn't true. It's very much people look to therapists as some guidance and as someone to lean on, but a therapist has to maintain a professional role, so this isn't possible, and often that is miscommunicated in sessions, and often the client or patient will misinterpret it and take it the wrong way, friendly gestures, kind of thing may take them as them trying to be friends, but this isn't it. But on the flip side of that, the relationship just doesn't work, it doesn't kick off at all. The patient may see the therapist as someone who wants to get in their business, wants to know too much, is a know-it-all, thinks they understand, kind of thing, and so there's little trust there, which can make communication between therapist and client very limited, very aggravated, should we say. So it's, talking from experience, trust with a therapist is important, and I didn't have that at all. I did not trust her one bit, but I tried to. We just didn't hit it off from the word go. She was a family therapist and I didn't want anything to do with my family at the time, so that was obviously not going to work. And those that do struggle with the relationship with their therapist and talking with the therapist and being brutally honest about really difficult things, need to try and find a therapist that they can work with, so that the work is productive and positive, because you see a therapist because you need help, and if you're not getting that help, then you need to see a different therapist, one that can help you. One issue I definitely had, and I've seen a lot of people have in my friendship group and on Teen Help, is that they're worried their therapist will tell their parents. Now, I'm not sure in America and other countries, but I'm pretty sure it's quite similar. In England, we have a confidentiality policy, and that states for reasons why and for situations why a professional must breach confidentiality, and that is when someone is being harmed, when someone is hurting someone else, and when someone is hurting them. I think I just said that wrong. Start again. When someone is being hurt, when someone's hurting someone else, and when someone's hurting themselves, but also when someone's committed a serious crime. So in those 4 situations, your parents may be told, but it depends to what extent it is and what situation or context the therapy is in. Because if you're seeing a therapist for self-harm, obviously you're harming yourself. So it may not be necessary for your parents to know if your parents already know you're seeing the therapist. However, if they don't know you're seeing the therapist, then it may be necessary for the therapist to tell your parents if they're unaware you're going there, and if you're under 18. If you're being harmed, again, it depends what context it's in. If you're seeing a therapist because you've been abused, that is very different, because you're there to talk about the ways in which you were harmed, and that may have led to a mental health disorder, such as PTSD, post-traumatic stress disorder. You may have developed OCD from it, or an anxiety disorder, anything like that, depression. So your parents won't be told if that's the context it's in. Similarly, with if you're harming someone else, if that is part of the mental health condition, your parents won't be told. I think parents are mainly told when it's unknown to the parents at all, and they feel that when you leave this therapy session, you will not be safe. Their main role is to keep you safe and help you in every way they can. They can protect you whilst you're in the therapy session, but they cannot protect you whilst you're out. So their role is to ensure that you're safe when you leave that session, and if they feel you won't be, then they should tell your parents or other professional, whether that be police, a doctor, social worker, anything like that. The other area was approach your doctor, talking to your doctor. Telling your doctor you think you have a mental illness or condition is a tough one. But I think in these situations it's best to just get out. It's like, but use their script to help you. When they say, "Oh, hi, how can I help you?" you literally just go straight in for it. Go nose diving. Just say, "I don't think I'm right. I've not been thinking right for a while now. For example, if someone had OCD, I'm having these tendencies to have to do things 3 times, and it's really stressed me out. I don't know what to do. Do you think it could be OCD?" There you go. I know it's not as simple to do that, trust me, I know. But it's best just to get it over and done with, to settle yourself and to get the best help possible. One thing I want to mention is that they are most likely to refer you to a psychiatrist for a diagnosis, but I'll talk about diagnosis in a minute. They may be able to give you medication, but it's most likely that the psychiatrist will give you the medication and offer you the therapy. Taking online tests and quizzes and then saying to your doctor, "Look, I've taken this online quiz," is not a great thing. I don't think the medical profession like it that much. And they don't find it they feel a bit undermined by it. But if you have taken one, you could always take it in for them to look at. But leading on from that, taking online tests and diagnosing yourself is the wrong thing to do. So with diagnosing yourself is a dangerous thing, whether it is for a mental illness or a physical illness. I just want to mention that now, even though it's not all to do with mental health. Diagnosing yourself means that you're not getting the right treatment. You're treating yourself for an illness you don't have, which is a danger in itself. So please don't do that. If you're really concerned, in England you can go on the NHS choices, NHS Life something, I can't remember, but you can do like this this questionnaire thing, and it'll tell you what they think's wrong with you, and they can get a medical professional to ring you up to talk it through. If you don't want to go to a doctor's surgery because you're scared or you can't get there or whatever, you can get help, and I'm sure there's something like that in America or Australia or wherever you are. So do not fear, there is a way to get help without going face to face with the doctor. But it is recommended that you go see the doctor because then you can have face-to-face conversation, they're more likely to take you seriously and all that. Some people do like being diagnosed though, and this is the kind of thing I want to talk about with diagnosis. Some people like being diagnosed because it gives you the opportunity to get the help you need, and it's quite a reassuring thing, especially if you feel like something's wrong with you and that you're not normal. It can be quite a relief to know that that you are normal, but you just got like this quirk, and that can be fixed with medication and therapy and all those kind of things. But other people don't really like being diagnosed because it may like jeopardise future prospects. Like, I know I didn't want to go to the doctor about my mental health because I was so terrified they wouldn't let me in the army. They won't. But that is a reason why some people don't like it, but equally people just don't like going because of the fear attached to mental health, the like negative attitude attached to it. Like, people tend to see mental health as the crazy people. You're not crazy. You're not crazy. You're just not well and you need a bit of help. So that's another reason why people may not want to go. That's kind of like my 3 things that I got from looking at the forums in Teen Help. I want to quickly talk a bit more about the stigma attached to it, and the stigma attached to like hospitalisation. Stigma is something that is slowly trying to be removed. I know the government has like campaigns like talk about mental health kind of thing, to try and get people talking about it, to drop the stigma, because it's just the same as any physical condition. It stops you from doing things. I know someone who has got a physical illness, and she never sees why I can't do some of the work and things like that. It's not because I physically can't, it's because I emotionally cannot handle it. Like, it's too much. She doesn't see it the way I see it. That's like a common thing. People see mental health as something that isn't as serious as a physical disability, but it's even more dangerous than a physical one, in my opinion, because you can't see it. You don't know when it's going to happen. You don't know when you're going to break into an episode of psychosis or like disassociation or anything like that. You don't know when you're going to like suddenly go whoa. Anyway, also the stigma attached to hospitalisation is huge. People think that you're a dangerous person if you get hospitalised. Being hospitalised is done in the UK underneath the Mental Health Act, and you can be sectioned on, I think it's 3 levels, and each one makes you stay in hospital for different amounts of time. I think the most is 6 months, but you can have that refresh, so you're in for another 6 months if they don't feel you're ready. You'll be sectioned if they want to diagnose you, if they want to assess you, if you're a danger to yourself, like if you're suicidal. if you're out of control. But equally, you can hospitalise yourself if you don't feel safe in the community, if you just need to get away. With regard to psychosis, a lot of people think it's when you go a bit crazy. It's not. It's a serious thing, and it's not fun. It's when you have reality and imagined reality merging together, and that's a bit scary, and I don't want people thinking that it's what crazy people have. Anyone can have it. You don't even have to have a mental health condition for it. Some people just get overly stressed and they snap. Psychosis, bang. So yeah, to just give you an idea of the different mental health things there are, there's like anxiety, social anxiety, schizophrenia, borderline personality disorder, narcissistic personality disorder, other personality disorders, ADHD, split personality disorder, bipolar, clinical depression, post-traumatic stress disorder. There's loads. There's millions of them, and they're not easy to cure, but they are manageable. Living with it is a whole different kettle of fish. It's about having a good support network, and kind of you have to be a bit open about it, because people will worry and they will want to know you're okay, and also managing medication and all that, but I'm sure Shay will talk about that as it's under like lifestyle stuff, so I'll leave that to Shay. However, if you would like to know anything about a specific mental health condition, just ask and I'll be happy to make a video on that one for you. I should be able to do it pretty quickly. But yeah, I'll be more than happy to make a video for you if you want to know just about one condition. I do study at A-level, so I do have a pretty good idea. Yeah, that's kind of it for me. I don't really know how much I can say in one video because of the how broad it is. But yeah, that's me done, I think, and take care.